Right, and so I think we will get started. So this is about your questions that Rachel and I have gone through, and we are trying to answer, and hopefully we will do. So if we go through, you'll be pleased to know there is a discount code, and this is 20% off the BioReTherapy range, which is at Shop Beautiful and MedFX together. And the discount code is 20BIO, which is 20BIO. So obviously take advantage of it and stock up while you can. So who are we? We own the aesthetic treatment rooms and the aesthetic training rooms. My name is Helen Whyte. I am a dentist. I have been qualified for too long, nearly 20 years, terrifying.
Nice.
And we opened our clinic around 3 years ago. Just after the big COVID pandemic. So perfect timing to do it, obviously. And I opened it with Rachel as well.
So my name's Rachel Davison. I'm a dental therapist and a dental hygienist. So I have worked in dental practices for the same about 20 years now. So we're ready to do something different. So we then opened the clinic and our training academy as well. We opened last year.
So if we look at what we're going to run through today, so we just want to make sure that we cover, as well as your questions, we've kind of interspersed them in the appropriate sections for the webinar. So we want to just kind of introduce the peel again. So people who haven't used it, it's a bit more information about what it is. It's a biphasic TCA peel, but we just want to go a little bit more into the ingredients and what's there. The product benefits and its uses, the indications, contraindications and risks, the procedures and protocols, upselling, because we did have a few questions about upselling, didn't we? And the results and what kind of results that you can achieve with it. So if we go on to it, as I already said, it's a TCA peel. It's an innovative biphasic patented medical device with a biostimulating, vitalizing and peeling action. So it's made in Italy by a company called CMed. It's manufactured according to pharmaceutical standards to guarantee the highest quality levels. It's got an exfoliating and keratolytic action, so it promotes cell turnover by removing the outer layer of cells with a selective action on the corneocytes junction bonds. So it dissolves the bonds between the cells. It allows it to gently slough off the dull top layer of skin, and that reveals the smooth, glowing,
beautiful,
youthful skin underneath. The actions of the active ingredients on the skin help to contribute to a profound stimulation of the skin replication and the biosynthetic processes. So the actions are essential to counter the effects of skin aging and oxidative damage by UV radiation and pollution. So we've got two concentrations. We've got the FND, which is probably the one that more people are familiar with, which is the face, neck and décolletage. And then we've got the body, which, as it says, everywhere else. The FND comes in a 6 ml vial. You get 5 vials in a box. Generally, you're going to use approximately 2 ml per face and neck peel. So you're going to get approximately 3 treatments per vial. It means less treatments if you treat a bigger area, and you would need then to charge accordingly for that. The body is a 12 ml vial. You get 3 vials in a box, and how many treatments you get from this depend on the area to be treated. And we charge per mil because it's easier to explain that to patients rather than saying you charge per area. But we're going to go through the costs and things a little bit later on. So just to help to get a bit more understanding of where you'll be with that. So the ingredients, you can say, is a combination peel. So the ingredients are the same between both the FND and the body. The main difference that you can see on there is that the trichloroacetic acid is 35% for the FND and it's 50% for the body. So if we go through the ingredients, we've got our TCA, which stimulates the tissue for prolonged renewal. We've got our lactobionic acid, which has got a smoothing and a regenerative effect. Our salicylic acid is our VHA. It's lipid soluble, so it helps to break down the oil buildup in your pores. We've got tartaric and citric acid for smoothing and protecting the skin. Amino acids, obviously we've got our glycine, proline, hydroxyproline, which helps with collagen. We've got arginine, which helps to buffer the TCA. The vitamins are there to stop the skin being irritated. And then we've got our gamma aminobutyric acid, which gives the skin a really nice flash lift effect as soon as it comes off. So as soon as it's actually removed with water, it's one of the wow effects that your patients have, isn't it? That they really like it, because as soon as they look in the mirror, everything's lifted, everything's tighter, as well as the sort of long-term effects, you do get that immediate result that they want. We've got squalene and isopropyl myristate, which help to prevent the TCA from oxidizing and help to maintain the lipid barrier of the skin. So the reason of the difference in the concentration is that the skin on the body is thicker, so it can tolerate a higher concentration. It's just important to point out at this point that you must check with your insurers about using the body peel. So if you've got, you're qualified to use chemical peels, if you are medically qualified, you can usually get insurance for the 50% peel, but I believe it's only up to 40% TCA if you are beauty qualified. So please make sure before you're using the body peel that you are actually insured to use it as well. So it's a biphasic system. You can see that when you actually get the little vial itself, you've got this blue layer that sits on the top, and that's our lipophilic phase. So that's the isopropyl myristate and the squalane. So it's got a moisturizing action because it restores and maintains the cutaneous hydrolipid film. Our regenerative action because it increases hydration through direct and indirect mechanisms. We've got our filming and veiculating action. Yeah,
Easy.
Good words. These reduces transepidermal water loss, and it actually assists the sort of active principles to get through the skin. It stabilizes and protects, so it prevents this trichloroacetic acid oxidating, and it stabilizes the formulation. So it improves performance, and obviously means that you don't have to use it immediately after opening. The hydrophilic phase, which is the yellow part, and that's the bit underneath, and that contains all of our acids, amino acids, vitamins, and our GABA as well, gamma aminobutyric acid. So this has got a revitalizing action. So it increases cell turnover, it increases the production of collagen, elastin, and hyaluronic acid. It has biostimulating action, stimulates the fibroblast activity and activates the cutaneous proliferation and the biosynthetic processes. We've got the keratolytic and peeling actions. So this is the part where it removes the outer cells of the stratum corneum by breaking the corneocytes adhesion bonds. And again, it promotes the penetration of the active principles as well. We've got anti-aging, antioxidant actions, which reduces the fine lines by neutralization of the free radicals, and our anti-acne part, which is our salicylic acid. So it actually helps to battle acne, and it's got an astringent effect on our enlarged pores as well. So come to our first couple of questions that we got, which is how is BioRePeel different to the other chemical peels, and why is it safe all year round? So if we go through the benefits, we've got no expensive setup costs. So I found that with quite a lot of the bigger packages, you spend a lot of money setting up, which you may on stuff that you may not use. So at BioRePeel, there isn't a huge layout. At minimum, you need to purchase a box of BioRePeel. From MedFX, it retails about £135 plus VAT. We recommend the Forever Prep, which retails about £35 plus VAT, and you get around 10 treatments for that. Post-op treatment, we are going to use our BioRehydrate and our BioRelift. Again, you can buy the smaller retail sizes, £30 plus VAT, or the back bar sizes, which are 200 ml, which is £115 plus VAT. So if you buy the whole lot together, if you buy a box of F&D, a box of Forever Prep, and a 30 ml BioRehydrate, it's about £200 plus VAT. So I think if we look at kind of setup costs, it's reasonable. It's also straightforward to use. It's not particularly complicated. Rachel will go into this later on, but essentially you're degreasing the skin, shaking the vial, withdraw how much you need, rub it in the skin, remove it with water. You don't need to use a neutralizer. Water's for enough to take it off, and there's no complicated layering of products. So you're not putting on different products in a different order on a certain sort of pattern over the face. It can be used on Fitzpatrick's 1 to 6, we've got no lengthy pre-peel skin preparations. So there's no need for your patients to use tyrosine inhibitors for weeks, which again helps to keep the cost down for your patients. It's quite quick in surgery time. So the peel's only left on for 3 to 5 minutes. So it's a quick treatment to do in 20 to 30 minutes. It moisturizes and brightens at the same time as peeling due to the squalene. It's painless. You get instant results with our friend GABA. So you get a bit of, people can complain of a bit of a prickling, if anything.
Yeah. Nice.
It improves skin tone, so it makes your skin appear smoother. You get a more homogeneous appearance. Due to the 2 concentrations, it can be used for the whole body. They do say you get 0 frost, but I think most people who've used it said you still get frosting.
Yeah.
But you get immediate lifting of the skin due to the gamma aminobutyric acid. So as I say, the skin looks firmer. There isn't really a lot of downtime. Once the treatment's completed, the patient can leave and go straight back into their normal life. They're not generally red or particularly sore. Even the exfoliation afterwards is fairly mild. The reason it's safe all year round is because it doesn't photosensitize the skin. So you don't actually have to wait until the traditional peel season. So kind of like October to February or something. Where we all live in darkness. So that's the reason why it's safe all year round. So I'm going to pass you over to Rachel, who's going to talk to you a little bit more about the indications and the contraindications.
So indications for the peel. So if you've got a patient and if they're complaining about any of these things, obviously a peel would be a good treatment option for them. We're looking at things like fine lines and wrinkles, melasma, acne, blackheads, and any sort of skin imperfections, acne scarring, rejuvenation of the skin, keratosis pilaris. That's something that we'll have done in
We've
here.
had a couple of people in for that, haven't we? Yeah,
quite a popular thing. Skin pigmentation, any enlarged pores, poor skin texture. It can actually be used for more things than you would think.
sun damage as well.
Sun damage, yeah. Like sunlight and pollution damage. And whilst medical professionals can use the body peel, which is 50% TCE, people who are briefly qualified can use the FND peel. But if you check with your insurance company, see if they do cover you for the 50%. But as we have been informed by our insurance company, the maximum they will go to is 40. So just always make sure that you check with your insurance company. Is BioRePeel suitable for melasma and acne scars? Generally, the answer to this is yes, but as long as you know what's caused the melasma and the cause has been removed, then it can be treated. So, for example, if you've got a pregnant lady who has pregnancy-induced hyperpigmentation, she's gave birth, then you know that the cause has been removed. You do want to make sure that she's not breastfeeding because you don't want to do treatment on a breastfeeding woman, but you know that the cause has been removed, so you can treat it. If the cause hasn't been removed, you're wasting your time trying to treat it, and you're wasting the patient's money as well. And they're probably not going to be too happy with that. Pigmentation can be deep-seated into the skin, so it can be sometimes too deep for the chemical peel to reach by itself. So in that case, it could be appropriate to use it in combination with microneedling. Acne scars are also something that can be treated with BioRePeel, but again, for deeper scarring, it might be that you need to use microneedling in combination with the peel. This is an advanced protocol, so if you're trained in both microneedling and chemical peels, the protocol's available in the pinned posts on the BioRePeel community on the Facebook group, so you can easily access that.
It's a good group to be part of as well for support, isn't it?
Yeah. Not only have you got professionals like the actual Shop Beautiful are there, you've also got like
other knowledgeable
clinicians
in there who might have come across something that isn't particularly common, who can advise you on what they've seen before as well. Because I always think starting out, it's always helpful to have a little bit of backup.
Definitely. So contraindications, as I said before, breastfeeding is one of them. Pregnancy also. You don't want to do any aesthetic treatment on anyone pregnant or breastfeeding. Basically because it's never been tested, it would be unethical to run trials on pregnant women, so that's why you wouldn't want to do anything there.
I think most things in aesthetics is contraindicated, isn't it? Pregnancy and breastfeeding.
Yeah, there's very
Oh.
few things you can do. Allergies, if anyone's allergic to any of the ingredients in the BioRePeel, you're obviously not going to smear that on the face. That would be dangerous.
Not a good idea.
No. Also aspirin allergy. If someone's got an aspirin allergy, you don't want to use BioRePeel in that case.
Actually, with that, the Forever Prep, if they've got an allergy, we need to avoid the Forever Prep as well, because it has got almond oil in it.
If anyone has uncontrolled diabetes, obviously their healing's impaired, so you don't really want to be doing any treatment on them either. Skin infections, you don't want to run the risk of spreading or aggravating any infections. Not ideal. Active herpes, again, postpone the treatment. You don't want to be running the risk of spreading the cold sore across the face. They wouldn't thank you. Would not thank you. Any sort of dermatitis. So with dermatitis, your skin's actually over exfoliating. So any sort of peel is going to aggravate that condition. Active skin cancers. Now, doing any sort of treatment, a peel is going to sort of stimulate the blood flow to that area. So you do run the risk of growing or spreading the cancer. So again, don't do anything near that area. People who are taking Roaccutane also have increased exfoliation, so avoid doing treatment in those cases. Anyone prone to keloid or like hyperpigmentation scarring, the risks are increased. Now, if someone's got cystic acne, you will be wanting to refer them to the GP, and they'll possibly have a dermatology referral from there. So you're not really going to make any benefit there, just refer them straight onto the GP. Now, one of the questions that we have been asked is a patch test required for BioRePeel? If a patient has any allergies to the components in the peel, you're not going to use the peel.
Just avoid it. Don't chance it.
Don't risk it. If the patient has any general allergies to anything that obviously isn't in the peel, then CMED do recommend that you do a patch test to rule out any sensitivities of the components. So how you would do this is apply a small dot on the side of the neck and leave it for about 5 minutes, then neutralize it with water. Just take it off with the water after the 5 minutes. Now, obviously, if a patient experiences any reaction, you're not going to say to them, well, you've got another 2 minutes left. You're going to have to wait. You want to take that off straight away, and just remove that with water. And obviously, you're not going to do the treatment.
And make sure the patient's all right. They might need antihistamines. So don't just send them away. Just make sure they're all right as well. But it really is just to be on the cautious side, just to make sure that if they've got hypersensitivities as well, that's not going to be kind of transferable over to this. You just want to make sure they're safe.
Yeah, definitely. Safety first. Risks are generally rare with this treatment, but obviously they do still exist. So it's important that you run through your consent properly and you do counsel your patients with regards to risks and complications. So as you can see, we've got a brief list. We've got chemical burns, changes in pigment, permanent scarring, reactivation of the herpes virus, redness, scabbing, swelling, post-treatment infection, and obviously dry and flaky skin. This is called a no peel, but obviously you are still likely to get
most people I think get a peel. Yeah. I always peel if I have it. I always peel when I have it.
Just like it.
And also like a little
beautiful, like
peel beard. But I do find as well that some patients, if they don't peel, feel like they've not had a peel.
Yeah.
They're kind of like, well, where's me peeling? Even if the results are good, they still don't like it because they don't peel. So I suppose it's just saying to people, you may peel, you may not peel.
Yeah. Procedure and protocols. So before you start, always do your paperwork. So you're going to want your medical history signed and completed. Make sure that you're covered medical legally. So you want to make sure all of your paperwork is up to date. You need to make sure that they are suitable. Make sure it is the right treatment for the patient and their expectations are managed.
Like whether they're going to peel or not.
Yeah. You might peel, you might not peel. Take before photos and after photos. They need to be kept with your medical records for insurance purposes. But not only for that, you also can use those to promote the treatment. So if the patient's happy, then you can use those on your socials.
Make sure you get that consent first.
Make sure you get consent. Always have consent. And like everything, I like to have everything set up before the patients come into the surgery. Now, the reason for that is because I'm very easily distracted. Very easily. And I do talk quite a bit. So if I've got everything out before they come in, then I know I'm not going to forget anything. So just a tip. Okay, then another question that we've had is, what's the purpose of the forever treatment? A lot of people say, do we have to use the forever prep before we do BioRePeel? The answer is no, you don't have to do the forever prep. However, you're going to need to prep the skin. So why would you not use the same thing that was manufactured by the same people who've made the peel? So again, it was made by CMed in Italy, and it was made to go with this treatment. So for us, there's no reason why we would use anything else. It is a very good treatment itself. You will get instant results from it. It's been prepared for like epidermal tissue, like preparation before you do any aesthetic treatment.
I do sometimes do it as a standalone treatment,
Yeah,
though, just as a refresh as well for people.
It's like a little mini facial.
Yeah.
You can use it with a sheet mask or an LED. I use it before I do micro needling as well, or radio frequency. So the kit's actually made up of 2 phases, and it's got 4 actions. So the first phase is the microdermabrasion cleansing lipo gel. Second phase is the carbon salicylic mask. Inside the box, you're also going to get an antioxidant neutralizing spray. Now that's used with both phases. The 4 actions are microdermabrasion. So it has micronized spherical silica, which works in synergy with the lipophilic phase. It's degreasing, so it clears the sebum. It's got natural surfactants from fatty acids, which have been taken from coconut oil. It is pre-peeling, so it's a pre-peel peel. So
it's a tongue twister,
isn't it? So peel off mask, it's got salicylic acid, and it's also got vegetable carbon, which purifies, detoxifies, and also absorbs the sebum. And then with the spray, you've got that antioxidant action. So that has stabilized vitamin C, white mulberry extract, ruscus root, and phytic acid. So as Helen has already mentioned, it comes in 2 layers. So what you want to do is you want to emulsify the peel. So how you do that is you basically shake it. You shake it and it mixes the hydrophilic and lipophilic phases together, just like oil and water, really. And as you can see in this video, it'll give you like a green solution. And that's when you know it's ready to use, really. So to do the treatment, you want to degrease the skin. As I've already said, we use the forever prep. Don't have to use it, but if you don't, you're still going to need to use something that will degrease the skin. Emulsify the solution by shaking the vial. Now you want to go through the bung with a needle and syringe, and you're going to draw up your solution. Don't remove the metal collar, leave the rubber bung in place. And once you've taken the metal top off, the solution can actually be kept for 6 weeks. Not in the fridge. You want to keep that in a cool place, or you want to keep it in a cupboard where it is between 5 and 25 degrees. It's not a cold chain product, so don't put it in the fridge. Then before you apply it to the face, we always take the needle off, don't we?
That canny big needles, I think it does look quite
Huge.
threatening when you're going towards someone with them.
If you go near somebody with this needle, they're going to jump and go, what's that?
What are you doing?
So we always take it off and we'll just use the syringe without the needle.
But you have more control over it as well, don't you?
Yeah, you know you're not going to have leakage. So once you've took the needle off, what you want to do is you want to put droplets on the face, just as you can see in this picture. Then you can rub it in. what you want to do is you want to rub it in until it's sticky. So until it's a little bit tacky. Then use your timer. You want to be leaving it on for 3 to 5 minutes, depending on how comfortable the patient is. And obviously, if they have an allergic reaction, you want to take that straight off. If you notice frosting in any areas, sometimes you can get random little bits, can't you? Like tiny little white patches. If you notice that, you can just take it off that area. You don't need to take the whole lot off if it is just one area. Just to neutralize that area with a bit of water.
I'd also say, mind, if you're worried, just take it off.
Yeah.
Just take it off. If you're worried, if you're in any doubt, take it off. It comes off with water, it's fine. You can repeat it again.
Yeah. The first time you see frosting, you probably will get a bit of a fright. And then once you've seen it a few times, you'll know how to sort of deal with things from there. So as Helen's just said, you do just remove it with water. So a bit of gauze, bit of warm water, remove it, and then you want to put on some post-op care. Now, we use BioRelift and BioRehydra. This again has been made by CMed in Italy, so it has been developed to go alongside this treatment. So why would you not use that? You can sell these as home care. Now, if you're going to sell this as home care, it is going to help the results. You're going to get a better result, and the results are going to last a bit longer as well. Protocols. So how many treatments do we recommend? This is the protocols from CMed in Italy. This is what they recommend, and this is the people who've developed the product, so they know exactly what they're talking about. Now, this is basically what they're recommending. So we're looking at FND, face, neck and décolletage. Face, you're looking at 1.5 to 2 mils. Neck, 1 to 1.5 mils. Décolletage, 2 to 2.5 mils. Now, you're going to leave that on 3 to 5 minutes. You can do a course of treatment, 4 to 6 treatments, and you want to leave 7 to 12 days in between each course, like each peel. Then we have the body peel. Obviously, this, as Helen's already discussed, it is a bit stronger. This is for areas where the skin is thicker. So you're looking at areas like glutes, knees, elbows, anywhere, arms, legs, anywhere, just anywhere in the body, really. And you do get some really good results from this. So with this one, you want to be leaving it on a bit longer because, again, the skin is thicker. And so you're looking at like 5 to 10 minutes for this concentration. But because it's stronger, you want to be leaving it a little bit longer. So for the body, you want to be leaving it 2 weeks in between treatments. And again, 4 to 6 treatments, depending on how well they respond, really. Now, somebody has asked, how do we know how to price? So how do you know how much to charge? Somebody, say if they're going to have their back done. Now, we always see people for a consultation, and we would price depending on how much peel we're going to use. So we would say roughly 1 mil of peel will cover 10 centimetres squared. So just a 10 centimetre box, 1 mil, and then you charge per mil, just to make sure that you're going to be charging the right amount. It's going to be a fair price for your patient, and you're going to be making some money, basically. Another question that we've had: if a patient has facial hair, do you avoid the facial hair or reply all over? Good question. One thing that I'm going to recommend is lipo gel is very difficult to remove from a beard.
Yeah.
Very difficult.
Rachel has had experience of this,
tried it,
you?
yes. Yeah. And I can say from experience, it'll take a while. So if you look at what we're trying to do with the peel, you're basically trying to get a chemical solution evenly onto the skin to exfoliate the skin. Now, depending on how long the patient's facial hair is or body hair, it could either block the product from reaching the skin, it could make the product pool between the hairs, potentially causing a burn, or it can block the removal of the chemical solution, so trapping it in place.
Also risking a burn.
Yeah. Very short hair would be fine, because as long as the solution is going to reach the skin. So if the patient's going to shave with a razor, you want to leave it 48 to 72 hours after they've had a shave. Now, the reason for that is when you're shaving, if you think about it, you're actually exfoliating the skin as well. You're actually taking that top layer away. So if you're over exfoliating and then applying a peel, it's not a good idea, is it?
They're going to be very sensitive.
Definitely. So what we normally do is we encourage patients to use clippers just to clip the hair right back on either the body and or the face. Just make sure they clip the hair right back so that you've got short hair. They haven't over exfoliated, so everything's good to go.
Otherwise, you just avoid the beard. If they've got like this chap on the picture, if they've got quite a dense, longish beard and they don't want to remove it, that's fine. But you cannot use the peel effectively around that area.
No.
Just avoid it.
Definitely. Oh.
So aftercare. Another question, what aftercare do you recommend? So Rachel's already touched on this. So it's either BioReHydra or BioRelift that we generally recommend. So BioReHydra is actually a serum. So it's a fast absorbing hydrogel. It helps to moisturize, it helps to lift the skin right from the first application. So patients really like the refreshing kind of feel of it. It's got over 15 active ingredients. It's got micronized hyaluronic acid, which means it's very easily absorbed to kind of the deeper layers of the skin because it's so small, only 5 kilodaltons. It's got ocean extracts in it. It's got amino acids, vitamins, our favorite GABA in it. It's really good for biostimulating, revitalizing and moisturizing. So it can be used in the morning, in the evening, through the day. You can use it through your protocols to enhance the results of it. You can use it sort of immediately after treatment. You can use it for radio frequency immediately after treatment. You can use it for photostimulation immediately after treatment and sort of other aesthetic treatments as well. And then the other one is we've got BioRelift. So BioRelift is a cream. It's light, sort of easily absorbed emulsion. It's got a silky texture. It's got a nice sort of feel to the skin just from the first use. Again, it's got like 20 active substances, 5 more about the BioReHydra. It's got biomimetic peptides, which are enhanced by colloidal platinum. So it means that these peptides actually help to smooth any fine lines out in the skin as well. We've got the micronized hyaluronic acid again, the amino acids, vitamins, and then we've got a lipophilic phase in there as well, which helps to nourish the skin. So again, it's back to the biostimulating, revitalizing, and it's got the lifted actions as well. Like we've said, these are produced by CMed, so they're kind of, work alongside the other ones. In that we know that there's going to be no chemical interaction, same as for our BioRePeel all working together. We know that they're appropriate to use. If you're recommending this to your patients for their home care, this is kind of how I'd look at it between your dry skin, your normal skin and your oily skin. So if you have dry skin, you're going to be wanting a cream. Oily skin, the sort of hydrogel is a bit lighter, so you can use that for oily skin. Normal skin, they might want to buy one or the other. Either's probably fine, or one in the morning, one at night. Use the BioReHydra in the morning and then the BioRelift, which is a bit thicker for nighttime care. So what do you sell the retail products for? We retail them around between 48 and 51. It depends on the area and what you can actually retail for. So it's a lot cheaper for you in a clinic to buy the back bar sizes. So the back bar sizes work out, it's 200 ml, including VAT is about £139. The retail size is 30 ml, including VAT is £36. So as I say, it's about 40% cheaper if you buy the back bar sizes, but for retail, the 30 mils, you're looking at about 48 to 51 pounds with those. Upselling, do you have any tips for promoting BioRePeel? The best way to sell it is to get people to try it. So talk to your patients about it, talk to them about what it is, talk to them about what they're trying to achieve and how it can help. The other thing is give them an introductory price. Offer them a cut price in conjunction with something else. So because it kind of enhances other results, and if you're doing like, I don't know, like a mesotherapy or something, then if you use this before your mesotherapy, the results of both is going to be enhanced. So discuss with your patients, say in combination with the other ones, we can do a discount. So we charge, for example, we charge £75 a peel. You could say, oh, well, I'm going to do it half price as an add-on to this treatment for your first try. Patients are generally quite impressed as soon as it comes off because of the GABA, you've got the flash lifting effect. And then obviously talking to them saying this is going to improve your skin in between your injectable appointments. So if they're having their toxin every 12 weeks or they're coming every 6 months for their fillers, having this every 4 to 6 weeks is just going to help to maintain that and help to sort of help their skin as well. And I think the other thing, getting people to buy into a course of treatment is helpful as well, because your results after a one-off peel you're still going to see results, but I think for big changes you're kind of looking at 4 to 6 treatments for that. If you can package in your aftercare as well, so you know that they're going to be using the right thing. So if you say 4 treatments, and if you buy 4 treatments, I'll throw in your aftercare for free. Yeah, okay, you're taking a bit of a hit on that, but they've also signed up for 4 treatments. And I think as they see the results going on from their before and after photos, which obviously we're always going to take, it means that they'll actually see the results and want to carry on with that. Before and afters are really powerful. We know that they're really good on social media, but again, it is difficult if you haven't had your patients to buy into that first. So I do think it's just kind of almost, again, with your filler patients saying that, if they're having cheek fillers, well, we can repair the lost volume, but really we're trying to condition the skin over the top so we have a better result all around. It's that sort of thing, if you can. But as I say, packages, I think, are the way forward for that. So alongside other treatments, we can do injectables. We're going to use our BioRePeel before the injectables. We're going to use BioRePeel before photostimulation. We're going to use it after radiofrequency and before any topical treatments. So you can mix and match them really with what you're doing as well. And as I say, to add it on to your other treatments, it probably wouldn't take you any extra clinic time, but it's a nice little upsell for you as well. So treatment results, we just wanted to go through some of our results just so people have a little bit of a better idea about before and afters and what can be achieved. Our patients have given permission for us to use their images in this slideshow. Please don't screenshot them and use them on your own social media, because our patients haven't been consented for this. So just be respectful of that. Thank you so much.
So this patient, obviously, as you can see, had quite a bad breakout. Now, this is typical maskne. So when people were wearing quite a lot of masks, a lot of people suffered from breakouts. And a lot of people still are suffering with skin problems since then, just because obviously they can't maintain it. So this is something that we probably treat quite a lot of, don't we, acne patients. This is actually after 1 treatment. This was obviously BioRePeel FND, 1 treatment, and then BioRehydra for aftercare. Then the photos were taken a month apart. This patient again had quite a bad breakout. She was very, very self-conscious. This patient wouldn't leave the house without wearing any makeup, like not even to put her bins out. And now she's happy to go to work without any makeup on. So she's thrilled with the results.
I've never seen anyone so pleased with the results as she was.
She's so lovely, Oliver. So the product used here was BioRePeel FND. This was after 6 treatments. It was 8 months apart, and the aftercare for this was BioRelift.
So this again, one of our acne patients using the FND, 6 treatments. Aftercare was the BioRelift, and these photographs were taken 6 months apart. That you can see quite clearly we've got a big reduction on the outbreaks. This patient still comes and has peels every 4 to 6 weeks to try and keep on top of that. Skin texture has actually improved enormously since then as well. Keratosis pilaris, we've had a few people in with this, haven't we?
Yeah.
And we tend to give us good results. This was with the BioRePeel body. We had 3 treatments 2 weeks apart. Again, aftercare we used BioRelift, which is again fine to use on the body. She did have a reasonable amount of peeling with this actually. The photographs were taken 2 weeks after her final treatment, so was that like 2 months apart. But again, you can see that the sort of skin textures improved a lot as well. And she was very pleased with the results and can go out wearing summer dresses without feeling self-conscious, which is lovely.
So this patient had quite severe acne scarring. So this is something we'll treat using a combination of FND with a bit of body in it, just to make the FND a little bit stronger, but obviously not as strong as body. It was also used in combination with microneedling.
It's one of our previous questions. So
yes,
as you can see, yes, it can be used.
This was after 4 treatments. The photos were taken 2 weeks after his final treatment. This patient was absolutely thrilled with the results. And we had just finished his treatment before we moved to Australia. So again, BioRePeel is a perfect treatment because it doesn't make your photosensitive.
Yeah, it's fine. All good.
Perfect.
As one of mine. So again, the BioRePeel FND. So there's only 2 treatments using BioRelift afterwards, and the photographs taken 4 weeks apart. We can see that although she has got a little bit of a tan there, that she's got you know, a good improvement in her texture there as well. So she was really pleased with it as well. So we did have a question, are there face-to-face training options? Yes, there are. Come to Newcastle and train with us. We'd be thrilled to see you. We're hosting a BioRePeel workshop in Newcastle on the 27th of April, 10 till 2. The Shop Beautiful do have various locations for hands-on workshops throughout the UK. You do have to be qualified in chemical peels to be able to attend. But we would give you all the product knowledge you need to use the BioRePeel effectively. You need to have a Shop Beautiful account. So those of you that might be registered with MedFX and maybe don't have a Shop Beautiful account, you would need to register with them and buy the BioRePeel starter bundle, which includes face-to-face training. I think it's around £500 including VAT. But you get the face-to-face training included in that. And then you go along and select Newcastle from the drop-down list.
Yes.
So we can see you here because we'd be delighted to see you. So yes, there's plenty of opportunity for face-to-face trainings, and we actually really do recommend hands-on training as well. I think it is a very straightforward peel, but I think it's something that it's helpful to see other people using it and seeing other results when it goes along as well, because everyone's different, everyone's skin reacts differently to it. So this is what we've covered today. We wanted to go through an introduction to it, the benefits, the uses, indications, contraindications, risks, the procedures, protocols, upselling, and some of our results as well. Getting the discount code 20BIO 20BIO, which gives you 20% off, and that's both at Shop Beautiful and at MedFX. So let's have a look through your questions in a second. Incidentally, you can follow us on Instagram at Aesthetic Training Rooms, and on Facebook we are the Aesthetic Training Rooms. Right, let me have a look then for your questions. Can we microneedle a BioRePeel for stronger effect? Yes.
Yes.
Do you sell a sample of BioRePeel aftercare products for our clients? No. The smallest that you can get would be the 30 ml. Obviously, you can give them a sample of it to take away. How strong is it in terms of result compared to the normal TCA 35%? I think the advantage of the BioRePeel is that you don't get the downtime, but you still get comparable results. So I don't think I've used a 35% TCA apart from BioRePeel, because the other ones have been lesser percent. So I couldn't comment on that. But reports are that it's comparable. You just don't have the downtime with that.
And BioRePeel's got the keratolytic action in, so not only is it separating the bonds, but it's also dissolving the skin that it's separated. So you that's how you don't get as much of a peel as.
It's because it's buffered with the arginine. That's why.
Right.
We've got a question if it's vegan. I don't know is the answer to that. So I think it is, but can you message us your email address and I will find out for you, or send us an inbox on Instagram. Butyrol insurance does not cover BioRePeel peel. What insurance companies cover this treatment? You'd have to ring around and check, because I'm not entirely sure. As far as I'm aware, like ours does, but we're with Hamilton Fraser and Cosmetic Insure. I don't know about the other ones. Would you be wasting time if hyperpigmentation was caused by sun damage? If your patient isn't wearing their SPF and they're still going out in the sun or still using sunbeds, then yes, entirely wasting your time, because the pigmentation that you can undo with a peel is never going to be as quick as they can destroy by going out into the sun. So unless that is removed sort of, and they're wearing a sort of complete sunblock and they're wearing a hat when they go out and they're not going to sunbathe, then don't bother. You're wasting your time, they're wasting their money. Can I confidently use this on people who claim to have very sensitive skin? Would you also use Forever or consider using BioRePeel without Forever? I'd patch test.
Yeah.
Patch test.
If someone says that they've got hypersensitive skin,
the other thing with the Forever Prep is that it does obviously degrease the skin. And I know there's a few people on the forum been saying recently, like they've had a lot of frosting and has the formulation changed? And we've asked the question and we've been told that the formulation hasn't changed, but we've seen more frosting as well. So if you think that your patient's skin is very sensitive or perhaps on the dry side, it may be a case of skipping out the Forever Prep. If it's, if you're concerned about it, then it's one way to kind of reduce down the irritants and to not strip the skin as much and not dehydrate the skin. Can I use this on someone on steroids? Depends what they're on steroids for. If in doubt, ask their GP.
Yeah.
Um,
Can't find the pin post on Facebook. Is it always open?
No, it's a document at the top of the pinned page. Top of the pin page. We'll check afterwards with Shop Beautiful. Is it going to be available? Yes, it's normally put on YouTube. Where are the protocols? We've discussed the basic protocols in the webinar here, and there are protocols in the Facebook group as well. Or if you are registered with Shop Beautiful, I believe they're there for download on Shop Beautiful website as well.
Yeah.
And those. Is it 3 to 5 minutes after you've rubbed it in to get tacky, or when you start rubbing? It's 3 to 5 minutes once it gets tacky. So as soon as it's tacky, you touch the skin and it's a bit tacky, then start your timer. Should clients stop any retinol prior to peeling? Definitely. I generally say a week beforehand.
Yeah.
Depends on the strength of the retinol as well. Can you give any advice on timing this with other treatments? Toxin, filler, skin booster? Yes. Peel before, injectables afterwards. Can I use these products with hydrofacial process? I don't do hydrofacial, so I have no idea. I would doubt it though, because it's hydrofacial is exfoliation as well, so I would doubt it. I wouldn't recommend exfoliation with exfoliation. We do have a question about BioRePeel being suitable for all year round use. What is it about BioRePeel that makes it suitable during summer months when other peels are not? Because it doesn't photosensitize the skin, but I've got to be honest, I couldn't tell you why it doesn't photosensitize the skin.
No, but we will find that out.
But we will find out. So Haley, if you drop us an inbox, I will find out for you. I think it is because it doesn't really make your skin peel. So it's a very light shedding of skin, but I will find out. Yes, the recording's going to be available. price per client per treatment. So it depends on your area of the country.
Yeah.
I think if you're down south, you're going to charge more than we do. We charge £75 per peel. If you charge a course, it depends on what you're doing for the course. You know, if you kind of want to throw the last one in for free, or you want to put aftercare in for free, that's kind of up to you. I had the peel, then 2 weeks later I had waxing, and ripped badly. Is that a result of the peel? I don't have enough information to answer that question. Obviously the peel will have sensitized your skin, but 2 weeks later, if you weren't peeling anymore, I doubt that's got much to do with it, but I really don't know. Couldn't tell you. Client who swelled on 2 occasions. Is this normal?
No.
No, I would be querying an allergy to that, and I definitely wouldn't do it again.
Definitely not.
No. Can we use it for rosacea? It's not indicated for use in rosacea, because rosacea is typically is obviously sensitized skin. And definitely not for people who are suffering quite a lot with an outbreak of rosacea. I think if dependent on their skin conditions in between flare-ups, but no, I wouldn't use it to treat rosacea.
No.
For the body peel, how long after leg waxing would you wait before peeling?
2 weeks normally.
Minimum.
Recommended.
Mm-hmm.
Depends on how sensitive someone's skin is. If someone's skin's really sensitive after they've had them waxed, they're going to need to leave it a little bit longer.
Yeah, you get, I think a lot of these treatments, when you're kind of alternating, you do get stuck in a bit of a cycle, because obviously they want the wax every however long, and then you've got to leave a certain length of time either side for the peel. So trying to find that balance. Would you use 4 mil to each glute, total 8 mils? It depends on how big the glutes are.
Yeah, some people have bigger butt than others.
Yeah, so you kind of, the best way I look to do it is, you know, the 10 centimetre by 10 centimetre squares of gauze. I get those and kind of lay them out and go, right, where do we want it to go? That's going to be like 2 mils there and 2 mils there. Or if it's like all over, because it may just be a patch that you want to treat.
Yeah.
So it really is just dependent on the area that you're treating. Charge of the peel again, £75 per peel. We use 1.5 to 2 mils, which generally covers, depending on the size of the face and the neck, but generally will cover that. After a course, would maintenance be 1 every 4 to 6 weeks?
Yeah.
Yep. Can it help with scarring and dot pigmentation from bile scars? Without seeing the scars, I think it would be very difficult to advise on it. If it was just hyperpigmentation, like post-inflammatory hyperpigmentation, it is indicated for that, but it depends on kind of the scar tissue that's left behind. Does there need to be any gap before the patient's going on holiday with sun exposure? I'd still leave it 2 weeks.
Yeah.
Would I need training if I've already trained with Sunacos peels? If you have chemical peel training, I would still advise that you do product knowledge training. Whether or not that's online or hands-on, but I would always recommend hands-on.
Yeah, oh, definitely hands-on.
Do you want to do that one?
Will BioRePeel and microneedling help with overall anti-aging effect, or is it just used for acne protocol? It depends on the area. It depends what it is that you're treating again. So,
and how deep you need the peel to go, because that's kind of what we're looking at, really, isn't it? It's the depth of it. Yeah. So again, it's hard to say without seeing what it is that you need. I suppose the answer is yes, it can help, because it's going to help with all kind of skin turnover, but it's whether you need it to do that. I would do it without first and see, and do it like a course without. How soon after can they do the normal skin care routine? As long as there's no exfoliation in it, then just the next day. So as long as they're not using their retinols or their chemical exfoliants or their AHA cleansers for about 7 days afterwards. Can you use it on your hands? Yeah.
Yeah.
Yes, you can. Marketing videos, we don't have marketing videos for you. You can have a look on Shop Beautiful's website. They do have some downloadable marketing things. Have a look and see what's available. Would this be your treatment of choice for hyperpigmentation? It would be mine.
Yeah.
Yeah. The name of the Facebook group, it's BioRePeel Community.
Yeah. And there's Shop Beautiful.
That is the Shop
that-
Beautiful one, yeah. With needling, would you still cover the face with blebs first or just each area in turn? That depends on how quick you are.
Yeah.
If it's your first time doing it, I would do area by area because you've got to be quite quick to get it on and then needle. So if it's your first time doing it, just section the face up and do it section by section.
Because you still don't want to be leaving it on any longer than the 5 minutes.
Mm-hmm. Can you do peel and micro needling the same day? Yes. How would you use it? The protocol, as I say, we'll see if that's in the group. When you're in the end of the bottle, you don't get out the products as it sticks to the sides. Nah, sometimes you just lose a little bit of product.
Yeah, what you could do, I mean, if you know that it's the end of the bottle and you're going to be binning the bottle, you can take the bung off, and then obviously you can get
Bit more out then.
the last few
I've
breaks.
done that. How long would you wait for laser hair removal? I wouldn't be doing it if they're in a course of laser hair removal. I'd wait until they finish that course of treatment with that. How much peel do you get in a vial? You get 6 mils in a vial. Yes, you can use it on your hands. Realistically, what's the selling point of this peel compared to micro needling or microdermabrasion? It's just a different modality of sort of exfoliation, really, isn't it? Some
people don't like micro needling, find it uncomfortable. Micro needling, you're going to use that to use with a serum, aren't you? Whereas they're sort of different. They're different things, really. They're different modes of action.
How much should we charge for 1 mil from a client? If it's FND or body will depend on your decision, how long you're going to take doing it. So if it was a face peel and it was FND, but you were in for the full protocol and that's what you were doing, I would charge £75 for that, even if it was just that area. If it is the body peel, I think you have to have a minimum price for that. So for example, if you were going to charge, you decided you were going to charge £40 a mil, but I'd say that's after your like 1 mil. So I'd say, like, if you were, let's for example say you're going to charge the same as a face peel because that's the time it was going to take, £75 for 1 mil, then plus £40 for each additional mil, and try and work it out that way as well. I think we've got to the end of the questions. If anyone has any other questions, please feel free to send us a DM on Instagram or Facebook, because we will answer as much as we can for you. I think if that's it, we shall sign off for the night. I hope everyone has a lovely evening and you have found it useful. But again, don't hesitate to get in touch with us if you need any more help. Thanks, everyone.
Thank you. Bye. Bye.